Good afternoon, everyone. The moment we say half zone or zone, so the first thing which comes in our mind is it is related to ROP. So, but today I am talking about this zones in adults. So, case 1 is a 48-year-old male complaining of diminution of vision after blunt trauma in the left eye, and the vision dropped down to 6/60. Anterior segment was within normal limits, and this was the fundus picture and the OCT. And he was diagnosed elsewhere as a post-trauma multiple hemorrhages. So this was a wide field fundus photo showing the multiple occlusions, hemorrhages, especially in the periphery. So the physician workup was done. His lipid profile was totally deranged, and the blood pressure was 168/98. So the angiography was done, and we could see only that in the periphery there was total CNP areas. And the laser was done in such cases, and the patient was followed up. So this was the case of peripheral vascular occlusion. So now coming to case 2, 65 years old female, diminution of vision in both the eyes of 1 month duration, and was diagnosed as a case of both eyes occlusive vasculitis. So these were the fundus pictures of the right eye and the left eye. In the left eye, she was also having a full thickness macular hole. This is the OCT. And the further systemic evaluation was done, and she was detected as a case of pulmonary thromboembolism. This was the FFA picture showing the half zone in the left eye and zone 1 in the right eye. The lasers was done to the ischemic retina. Case 3, a male, 65-year-old, diminution of vision in both eyes of 5 months duration, and was diagnosed as a case of neovascular glaucoma. This was a fundus picture, minimal hemorrhages, yes, sclerosed blood vessels in the periphery. This was the OCT, and the further systemic evaluation, he had HbA1c of 9.3, the random blood sugars was 231, carotid Doppler was normal, echo and the angiography revealed the blockage in the major vessel, and the patient underwent CABG. And after that, when the FFA was done, this was the picture with the multiple NVs and the CNP areas. In this case, the laser was done and the injection anti-VEGF was given. So what is oculomics? It is the retinal structural and blood flow changes which are associated with the systemic and the CNS illness. And in these cases, the ocular imaging is used to diagnose the systemic diseases. So what we learnt is vasculopathy in not known systemic diseases, they may present as more severe diseases, and don't just rush after anti-VEGFs or the lasers without doing any systemic evaluation in such cases. Thank you.